Hi everybody, welcome back. It must be Wednesday.
Hi everyone.
Here we are at San Antonio Cosmetic Surgery, and it is the month of February, which means it is the kissing month. I mean, it is the month of Valentine's Day coming up fast and furiously, and so our attention turns to all things lips.
Right, all things lips, all things love.
And so we're going to talk a little bit today about lip filling and lip augmentation, and Cynthia, our nurse injector and expert at this, is going to guide you through some questions about filling the lips to get a very nice natural result. Of course, we're not looking for duck lips, we're not looking for any sort of overdone, but something very tasteful, very beautiful, and something that you can really enjoy, especially with Valentine's Day around the corner. We have a beautiful model who's been kind enough to let us do this with her. What's your name, dear?
Mariah.
Mariah, thank you so very much. And Mariah, do you have somebody special that you're hoping for Valentine's Day?
Yes, if she behaves.
If she behaves, all right, well, hopefully everybody's watching. That's great. Okay, so Miss Cynthia, please take it away. What are we going to talk about today? What particular product?
Today we're going to be doing first, of my two products that I use for my lips. I can use the Juvederm Ultra Plus, which is what I like. It gives you a nice full lip. Gives you a nice pullback on the lip to give you more fullness. And then I've got my Volbella, which, I sneaked over here and took over here. My Volbella, which is going to be my lip filler that's just going to give me a little bit more contouring for her in her upper lip. As you see, she has a really beautiful full lip to begin with. She's got a nice pout, nice definition. I just want to kind of create a little bit more of a lift with the top and define the upper lip, and that's what my Volbella will do for her. It won't give me too much projection because she already has a nice, I just want to define the upper lip. Okay.
So I just want to say, as we get started, all of these fillers that we use here are part of a hyaluronic acid family, all made by Allergan. Juvederm is the family of products. It can get a little confusing. So there is Juvederm Ultra Plus, there is Juvederm Volbella, there is Juvederm Voluma. And so different places may refer to things differently. But again, these are all Allergan products. Allergan brings us Botox and some other things. But one of the things that's important to come to a specialist like Nurse Cynthia is to have the right product used for your desired goal. Because I imagine there are some products that we wouldn't want to put in our lips.
Yes.
Right. All right, so I'm going to leave you to it. Happy Wednesday, everybody. Nice to see you all. And remember, some other things. We are having an event on February the 8th, an awesome event, which will showcase the wide variety of services that we have here at San Antonio Cosmetic Surgery. Please like us on Facebook, and if you have questions or would like to come for a visit, by all means call us at 210-614-4320.
Okay. And you all saw the Facebook where we invited you all to our beautiful little event. February the 8th from 5 to 8, we're going to be doing some live demonstrations. We're going to have some raffles. We're going to be doing some food, some drinks. You'll get to meet the entire staff. You'll get to ask any questions you might have regarding our actual procedures like breast augmentation to tummy tucks, liposuction, and then all the other offers we have with our spa. Amy will be here. She'll be with our medical spa, just showing our treatments, and then I'll be doing some fun stuff. So they always enjoy that. You come in here in this little room and we'll get to show you what we do hands-on.
That's awesome. So San Antonio Cosmetic Surgery, the practice of Dr. Ortegon and myself, and Dr. Ortegon will actually be at that event. I'll be traveling to a conference to go get smarter on some things, and it'll be fun to do that, but Dr. Ortegon will be here to answer your questions, and so we look forward to seeing you on the 8th, and take it away, Miss Cynthia.
Okay.
Thank you.
Thank you.
All right.
Bye, everybody.
Bye, Dr. Bumholz.
I'm going to turn on my light because he turned it off for me.
And if you're just joining us, we're here at San Antonio Cosmetic Surgery, the offices of Dr. Michael Bumholz, who just left, and Dr. Delia Ortegon, board certified plastic surgeons. They just discussed our event that's coming up on February the 8th. Be sure to RSVP, call our office, share with your friends. We're going to be giving tons of prizes, live demonstrations, food, drinks. It'll be fun. Hopefully you'll join us. Now we have our lovely model, Mariah.
All right, Mariah, you'll feel probably a little bit of cold first from my spray, which is my signature. I love to use this spray for patients. Even though I already had her sitting here for numbing, I'm going to actually do this. And I'm going to actually, as you can see, I'm going to go right in the border for her.
And
right.
this is the Volbella.
Yes,
that
this
we're
is the
doing.
Volbella, which is a little bit softer. And what I want to do is create just a little bit more of the illusion for her, of her upper lip. and trace it right in the border.
It's where the lip liner goes. For those of you who wear lip liners or outline your lips, this is going to give her a really nice shape. Because you can see she already has fullness in her lip.
Yes, she does. So what I'm trying to do is just create a little bit more of like what I call icing on the cake. As you can see, I'm trying to create that you can compare both sides. Her bottom lip, like I said before, she's got a beautiful bottom lip. It already drops nicely. I just want to create the upper lip for her. And I'm doing just a little bit in the border. As you can see, it goes in and it just plumps it up nicely.
And this is Mariah's first time ever getting any fillers.
Yes, so now I'm going to go right at her Cupid's bow. I want to create a little bit more of that for her.
That's a side angle, and the Cupid's bow is that little indentation above.
Peak that she has there that gives us just that kissable lip. And now you see a little bit of bleeding, and that's normal. It never fails, you know, but it's nothing drastic. I just put a little bit of pressure. Are you okay, Mariah?
Mm-hmm. My eye watered, but it doesn't hurt at all.
Perfect. The numbing cream, I think, really helps. It helps me support just to give you a little bit easier for me to work around your lip. Okay, there we go. As you can see, it starts to enhance just the lip nicely. Shape it up. Okay. Now I'm going to go and do a little bit on her, these borders right here. She's kind of flat up here, as you can see, so I want to create that to give me a little bit more of a lift. I always tell patients this is a little bit funny, but.
And that spray is a cold spray. Cynthia spoils her patients, wants them to be as comfortable as possible. You don't feel the stick as much, and it is a tiny, tiny needle. And she is enhancing the two columns right under her nose.
See how just that'll give me a little bit more of a natural lift for her with not creating too much.
And as we get older, those actually start to deplete. We lose fat in our face, and those columns start to flatten out.
Okay, here we go. I'm going to the other side. Same thing. I'm going to spray her.
Kind of the difference already with the one side that she's done. She's doing now the other side. Now this product is called Volbella. It's not so much to bring fullness to the lip.
It's basically to contour, give you a little bit more of a shape. Some people that have fine lines around their lips and tell me, hey Cynthia, you know, I just want a little bit. I don't want too much of a lift on my, because some people are afraid. They are afraid that maybe it's too much of product for them. So Volbella gives me that nice softness. Kind of call it like icing on the cake for some patients.
And she's done there. How are you feeling, Mariah?
Very good.
Good. Would you say it hurts on a scale from 1 to 5?
1 to 5, it's probably a 1.
Awesome. We make sure that all our patients are as comfortable as possible. Nurse Cynthia has a touch of an angel.
There we go. And like I said, the spray, again, I have numbed her already.
With some numbing cream, a topical numbing cream, and then we spray the cold spray just to avoid, or so you don't feel the little pinch of the needle when it goes in.
Exactly. So now you start to see how you basically can have more of a shape. I see a little bit more of the lining of her lip. Now it's balanced with the bottom of her lip because like I said before, she has a nice base to begin with. She's got fullness right down here on her little pearls. Now we can equally be as balanced with a little bit of the filler. And what you see is what you get with Volbella. It holds no water. It just actually maintains the beauty of it. The product goes in and it sits there nicely. That's one of the reasons you've seen me do it under the eyes, is because it sits under the lower lids and makes me a nice little shelf that just softens up. So right here you can see right in there the border, the corners.
Right, and we're still on the one syringe. Volbella is sold by the syringe. We are offering an amazing promotion called Now and Again, where you buy one syringe with $200 off. So this is a great time to take advantage of it. Again, she's enhancing those columns right under the nostril.
There we go.
Oh yeah, that looks really pretty. Feeling okay, Mariah?
Yes, thank you.
And this is Mariah's very first time getting fillers. You can see she already has some beautiful full lips. And we're just icing on the cake with our Volbella. We do accept Brilliant Distinctions points, so you're welcome to come and redeem those here during your treatment. This is an Allergan product.
There you go. So as you can see, I've actually done all the borders. I've created a little bit more of a lift. Now I'm going to go a little bit to the peak one more time on this side on our Cupid's bow, because I did the Cupid's bow on one side. Now I want to create the other one.
Now our promotion is going on till March 31st, but we only have a limited supplies of the rebates, so you do need to call our office and reserve your rebate. We only have so many. You have to have the treatment before March 31st. We will be issuing them at our event on February the 8th here in our office. So please call and RSVP to our event, or call and RSVP for your rebate so we can hold one for you. Because once we're out of them, while supplies last. Exactly.
Any questions, Jen? Anybody have any questions?
They want to know how long the Volbella lasts.
Okay, the Volbella is going to last you just possibly as long as the Juvederm. 9 to 12 months. I get my patients, it usually lasts about a year. It's really a nice product. That is always the beauty of these hyaluronic acids. They really take in, they absorb. I also ask patients to definitely always maintain lots of moisture in the lips. The more moisture you maintain, the longer the product is. It is a muscle around the mouth, so you are going to be talking, so you wear it like anything else. You will metabolize it. It's not a problem. I mean, it's something that naturally is done. So what we'll do is we'll have you come back in maybe 9-10 months, see where you're at, see if you're ready, and I'll say 9 out of 10 patients that have this done will come back at 9 months, even though they don't need it, and say, oh, but I'm ready because I feel some of it has gone down, and that's okay. Right. I don't mind. I rather do baby steps and kind of add and build up so we can maintain than to try to add more. There we go.
For sure. Now you can see this isn't for people who, or this is for anyone. If you just want a little bit more definition in your lips, this is a product that works great. We also have the product that fills the lips as well, that gives you a little bit more of a pouty. Let's get a side profile view so you can see.
And you can actually see with her.
Wow, that looks
we did
great.
A side profile. We took pictures of her and we can see them.
Now it is a little bit swollen, right? When you get it done, we just pinched it.
Little, Jen.
Tiny.
Yeah, this is different than the Juvederm. This is not going to hold on. It's almost like what you see is what you get. That's the one thing I like, you know. So this is really, really nice for her. I'm going to just.
And that's a very nice side profile. We do always take before and afters. So we did take pictures to show her, because a lot of times once we get fillers and we keep coming back for the fillers, we forget what our original lips look like. You're so used to seeing yourself with these fabulous, well-shaped lips. And so we keep those pictures on file.
Yes. And so now I'm just going to put.
How are you feeling, Mariah?
Good.
Good.
Okay.
See?
And that's about it.
See how pretty that, I mean, no downtime. She can go back to work.
Beautiful.
No one's going to know. It's going to be really, really easy for her to recover from this. Got that, Jen?
Excellent. Yes, all right. So we're now going to show you.
Okay, so now she's done great. Again, Volbella for her, just a little bit with icing on the cake. Make sure that she gets a little bit of fullness. She likes it. She's not too dramatic with her look because she has a beautiful lip. You can see right there.
What do you think, Mariah? Yeah?
Yeah, I love
Awesome.
it.
And you can wear lipstick right after. You can walk out
Definitely.
here with some lip gloss, ready to go.
Right.
You're awesome.
I love it. Thank you.
You're
Perfect.
welcome.
All
Thank
right.
you for being our
Thank
model
you,
today,
Mariah.
and we'll
Thank
see
you
you at our
much.
event for sure. Now, Mariah will probably be here at our event
Yes, I will.
to share her experience. And then we have our lovely next model,
Celeste.
Celeste. Hi, Celeste. How are you?
Just came from work.
So This is my next model. So I'm trying, as you see, to show patients that I'm doing different types of lips. So someone like Mariah that had full lips did really great with a product called Volbella, which is going to give her a little bit of a lift, just kind of enhance. And then I have Celeste, and I picked Celeste because she's a beautiful bottom lip, but you see how she's missing the top lip, and that's what I get the most of. Patients will come to me and say, God, I don't have an upper lip. That's what really bothers me, you know. And so that's what, that is the bulk of my lip practice. So I've already numbed her, and so I'm just gonna take this numbing cream off of her.
We've numbed her. We've taken her pictures from several angles so we can show her the after. And Celeste too is her first time getting fillers. So for all those people who are worried or afraid, you're seeing live exactly what a brand new patient is going to go through. Now we've discussed all the
I do a medical history on
options,
her.
yes.
I'll go over if she has any allergies, if she takes any aspirin, anything like that. You guys get to see just a little bit by the time they sit in my chair, but we go through a little detail beforehand. So again, you see how beautiful her bottom lip is shaped. I love that. But she's short right at the tail end of her lip. I want to bring it up to balance out a little bit more of her lip. She's flat also in her Cupid's bow down here and a little bit on her filter columns. So here we go. I am using Juvederm for her because this definitely I want to enhance, and I want to definitely pop out the lip a little bit more.
and this is Juvederm for
Ultra,
volume.
yes, and I use Ultra Plus. Remember that, Jen?
Yes,
Just 'cause I stick to that.
Juvederm Ultra Plus. This is with the Allergan family.
Yeah.
Allergan makes Botox. They make implants that we use here that Dr. Baumholz and Dr. Ortegon use here for breast implants.
Kybella.
And Kybella, which
Okay.
is a fat dissolver.
So first I go to the body because I want to enhance her body, and you can see right there. We're already plumping up a little bit. And then I go back in and I massage.
Awesome. You can already see the difference with just that little injection.
Again, I'm going to go to the body.
Little prick. Go.
There we go.
Yeah, that's nice.
You didn't feel anything, right?
Yeah.
I think everyone's always surprised how well you're going to do. They are afraid that this is going to hurt, but I say my numbing cream and our spray is magical.
So be sure to call and reserve your rebate. Right now we have $200 off all our syringes, which brings a syringe of Juvederm to $475.
Wow, Jen.
That's amazing. So please call, RSVP to our event, share, like our Facebook. We'll be doing more live demonstrations the night of our event. We'll have drinks, prizes, food.
Our events always turn out really nice. Jen does a real hard work. From this time now, so I'm surprised I even got her to do my live stream today. She's going crazy in her office trying to just arrange everything for our events. It's always nice to show our patients what our practice can do for them with our doctors, our spa, myself. You know, just information, anything you want. It's all about education for our patients. Make sure they know what we can offer them.
Well, we're also going to be demoing our brand new Selfina. You can see the sign in the back. How you did, Celeste? Yeah? Wait, bring it in. All right. We're going to be demoing our Selfina treatment. This is going to be a big treat. We have a model that's going to be there. The doctor will be performing the Selfina. And our Selfina, what it does, it is a cellulite reduction. It doesn't remove any fat. It releases the dimples in areas where cellulite is very pronounced, mostly the buttocks. So Dr. Ortegon will be performing that live stream. We'll have a live model that day, February the 8th. Mark your calendar, share with your friends, RSVP, please RSVP. And save your rebate, because we do have those promotions and their while supplies last for both Botox and Juvederm, and all fillers actually.
So the Selfina will have a patient that's going to be sitting. We're going to lie her down, Jen, and show exactly what it goes through, how long it takes, the process.
Yes.
It's a real, you know, we have a lot of people through the years that have always asked about this treatment. Finally, we have something, and it lasts how long, Jen? They told us 3 years. So
3 years.
It's a really nice procedure that patients can do once. We can treat all that area. You can walk out of here. Patients are really calling for it and asking lots of questions. So it'll be nice to do a live demonstration.
And this is mostly for patients who are already at their ideal weight, they're working out, they just developed these annoying dimples.
Yes, and it's a lot of it's genetic. So we've been talking about this. Patients like, well, I work out 5 days a week, and I still get this. Their strengths are pulling on the skin. So what we're going to do is release them so we can have more of a smoother contour usually in that buttock area, and soften them out. So here comes spring break. Here comes the summertime. People are going to want to wear their bathing suits, and they want to make a nice contour. That's what they're going to see with this treatment. Okay, now I'm going to do a little bit of her Cupid's bow right there.
Okay, and Cynthia is injecting some Juvederm for fullness in Celeste's upper lip. She was numbed prior, and we took her pictures.
You see how I'm balancing out now her lips with her bottom lip now? And I'm squeezing a little bit for her. She's probably thinking, God, Cynthia, that hurts more than the injections, right? Yeah, that's what
Well, it
everybody...
doesn't really hurt. It's more like it feels weird.
For sure, yeah. Because you're numb.
Yeah, that's
And you will
probably
leave here a little bit numb, so...
Can I make out?
That's a
for
good
Valentine's,
question.
Yes.
That's a
People
good
will ask me, can I kiss? Yes.
Like
And-
right after?
Yeah, and I say no.
Oh, okay.
Don't ruin my work, I always say.
Oh,
We
okay.
like for it to settle in. We give you instructions after your injections. We tell you also before. So if you have a hot date or something right after your doctor's appointment, there are things that we like you to steer clear from.
Now you see how natural it looks. So my biggest question from patients is, are you sure you're not going to make me look like a duck? Are you sure it's
Yeah.
not going to make me look funky? People are going to look at me and, oh my God, what did
They're
you have
gonna
done?
know.
They're going to know. This just balanced her. Look at how beautiful her bottom lip already is to
Oh,
begin
that's
with.
gorgeous.
We balanced her out now, so when she smiles, it gives me a little bit more of a curl. You see her beautiful teeth. I'm getting a lot of these patients that come in and they're like, I want to look like this, I want to look like that, and everybody knows basically what I'm talking about. Everybody wants somebody's lips. And I always say your anatomy is different. I've got to work with what you bring in, and we've got to make it look as natural as possible. That's the beauty of this. We want always to make those lips look natural, not something that looks distorted or looks overdone, because you don't want people to look at you and go, oh, yeah, you had your lips done.
That's
I
true.
know.
And
We
this
want
is immediate gratification. You can see exactly, you're walking out of here with immediate results. Now, Cynthia also does Kybella, Botox. She does all the injectables here at San Antonio Cosmetic Surgery. Please call us, reserve your rebate, the promotion we're running, RSVP for our event.
Look at this. Tell me she couldn't go back to work.
Oh,
So
that's
Celeste
amazing.
works in a doctor's office. She works for great practice, 3 OBGYNs. She's up front
Right.
all the time. So she's constantly
Yeah, I got it.
greeting patients. So she's going to go back to work, and no one's going to know anything other than what a beautiful smile she has, what a great lips she has, what friendliness she can show. This
Right.
is going to be really nice for her, because I think many people will be like, God, can I go back to work? Will people know? People are not going to know. They're just going to find something's different about you, and it'll just be a balance in your face, from her cheeks to her lips to her chin. That's basically what I try to do.
And this is a side
That's
profile
a side
here.
profile. What will happen is next week, Jen, we're going to do a big bang next week. Next week I want to do probably show.
Yeah. Well, next week we're having our event
Oh,
on
that's
Wednesday.
right, that's right. I'm
Our
sorry.
next week, on the
I'm
8th.
getting ahead of myself already.
We will remind everybody our
Yes,
next
we will
live
be.
stream, because we're going to be doing live demos that day. Next week, Wednesday. Mark your calendar, share it with your friends, call in RSVP. We'd love to see everybody. It's open to the public. Dr. Ortegon will be here. He'll be performing the Selfina.
That's right.
Cynthia will be here.
I will be here.
All our staff will be
After
here.
that, then I'm sorry to catch ahead of myself, but after that I'm going to do one of the events where I'm actually going to do everything. I want to have a patient, and I want you to see that I can do a procedure like I'm going to do a mid-face voluma.
Correct. Well, because
I'm
we
gonna
have
do
the promotion running till the
that's right.
31st.
So I want to do mid-face, Juvederm, nasolabial folds, and even Kybella. I want you to see that I can actually do all these things in one setting. It's something that can be done in a lunchtime. Something that can be done at a lunchtime. You can actually go back to work, The downtime's going to be minimal, other than you're working out. For all of my workout freaks that say, hey, I want to work out just 24 hours. But these are procedures that can be done in an hour's time. And the patients really don't have bruising or swelling, a little bit with the Kybella, but you're going to see that I'm going to get you a model that just has a little bit of fullness here, needs a little bit of the mid-face, lips, nasal, labial fold, maybe even throw in a little bit of Botox. We can treat everything at once. Since we are doing a big promotion, I want you to understand that these are things that can be done in the office quickly, under my hands, under my doctor's supervisions that'll be here, and then I'm minimal, but you can actually treat it all at once. And that's what you want to do. Start getting your plans now. Do a game plan for what you want to do with your face. We've got spring break, we've got summer, we kind of go into kind of feeling youthful. Consultations to come in to see our doctors too. If there's something that I can't do, then we have Dr. Michael Baumholtz, Dr. Delio Ortegan that can talk to you about a mid-face lift, brow lift, eyelids, anything, body, mommy makeovers. We've got the doctors too. What you want is to come in and be educated. That's my biggest flag I carry around. I want patients to walk out of here and go, God, I got all this information. We've got the spa also where Amy can talk to you about your skin. It's perfect timing to do the IPLs, the microneedling, all those little things that we don't think about. Right. It's time to start our new year fresh and have a plan. Have a plan for the year. Start planning ahead what we want to do. And we can make a proposal. Lisa and I work really well to sit you down, talk to you. Lisa does all our surgery scheduling. She's not here, she's out busy, but she can do a plan for you, what you want to do, what you want to plan for in the next 6 months, and we'll give you a written quote. I give you written quotes too on your plan for your face, and that way we can get started on it, okay?
Right.
Genevieve, anything else? Anything
No,
I forgot?
just join us next week. We'll be giving out reminders at our live stream on February the 8th, next week, Wednesday, and we'll be featuring our Selfina with Dr. Ortegan performing the procedure in a live model. Share with your friends. Don't forget to RSVP. Call our office with any questions.
210-614-4320. Like us on Facebook.
And we honor any brilliant distinction points.
Definitely.
We love your brilliant distinction points. We look forward to seeing everybody.
And let's get those lips in here, guys. Come on. It's February. We want to be ready for the month of love. I'm even wearing my red lipstick. You usually see me in nude, but I wore red lipstick today just to promote. And if you can, give us a call so you can prepay with your $50. That'll hold your spot and get your promotion. We're getting a lot of people booking now. I want to make sure I get everybody in. Okay, Jen?
They're reserving their
Yes.
their event.
Yes.
They're reserving their rebates, calling in advance because they're not able to make it. So just give us a call. We look forward to everybody.
Thank you, everybody. Have a
Bye.
nice Wednesday.
Thank you, Celeste. Bye-bye.
Thanks.